Good afternoon and welcome to today's State of the Community hosted by the Alvin Manville Area Chamber of Commerce. I'm Ashlea Quinonez with Memorial Hermann Health System and have the privilege of serving as the chair of the Chamber's Governmental Relations Division. We have been providing periodic updates from elected officials and community leaders throughout Brazoria County to keep us updated on activities and progress that our county is making during this time of COVID-19. Today's guest is our Brazoria County Judge, Matt Sebesta. Judge, thank you so much for being here with us today. Really appreciate your leadership during this time and I look forward to your update that you'll provide today. So I'll turn it over to you.
Thank you, Ashley. Thank you, Joanna. It's a pleasure to join y'all today. The last couple of months have been crazy months as we deal with the public health emergency, the pandemic. It is something that none of us have ever seen before and are doing our best to manage it. Thought we'd gotten pretty good at floods, and this is not a flood. So it's been an interesting 2 months. I've got a fantastic staff. I've got to give a shout out to my emergency management coordinator, Steve Rosa, who's done a good job. My PIO, Sharon Trower, director of the health department, Kathy Spruce, and our public health authority, Dr. Scott Rogers. They have been very instrumental, as well as Jerry Yenny and her staff, Sheriff's Department. Everybody's just been absolutely fantastic. And I've got some folks here that have been working each and every day. They've not had a day off since this started. They work in 7 days a week, and it has been an adventure, and we're learning something every day. But just to kind of give you an update, we're at as of the end of the day yesterday, we're at 673 cases in Brazoria County, and I'm going to share the screen on our dashboard. And so that anybody that hasn't gone out, please go out to our website, brazoriacountytx.gov, and the leading thing up there is our dashboard. And we've got, as you can see, 673 cases, 319 active, 345 recovered, and unfortunately 9 have passed away from complications. We get into the second page is a breakdown of by gender. You can see it's skewed to males, and the reason that is such is we have over 200 cases in our 6 prisons. They are all male prisons, so that is why we are skewed to about 2/3 male and 1/3 female. But when you take out our slightly over 200 cases, it balances out to right at 50-50, is which it would normally be. You go right-hand side, cases by age group. What you see on the green is recovered, red is active, and the number you see as in the 20 to 29-year-olds, the 23 is 23 active cases. And then you touch on the green, it shows we have 53 recovered. And then you go case by area, and you start out like the Wayne Scott unit where we've had a large number of cases. You won't see anything on recovered. Just hearing back from TDCJ, we don't get that daily information on the prisoners on how well they've recovered or have they recovered. We just have them as active, and unfortunately right there we have a deceased one at Wayne Scott. So you'll see that a lot of our higher number of active cases in our prison units, and we see all the way down to Little Sandy Point, which some people in Brazoria County didn't know. We had a community by the name of Sandy Point. They've even had a case. So that's kind of where we're at on our dashboard. I encourage people to continue to go out every day. We update it about 5 o'clock every day. One thing that's not shown on our dashboard is the 128 COVID positive inmates that TDCJ transferred into Brazoria County without our knowledge. They just did it, and I think they thought it would be a we'll beg for forgiveness later. Well, after they took some harsh words from me and from Speaker Bonin as well. But those are not in our dashboard numbers. So and that's noted on the dashboard, but I just wanted to cover that as well. So we can see our worst areas have been our prisons. We've also had a nursing facility in Pearland that we've had an outbreak, that we've had approximately 15 folks there have contracted the disease with one that has deceased. And hopefully that is now under control. We shall see. But also wanted to talk a little bit about testing. That can be a hot topic. We've had quite a bit of testing in Brazoria County. Our community network partners, they have a facility, a clinic in Freeport, one in Alvin, and one very close to Pearland that they have been from the start. They have been testing. It is income-based, so, and they've also been waiving copays. So if your insurance pays for 80% of it, you pay 20, they're waiving that 20%. So insurance covers it all. And of course, if you are low or no income, you have a low or no fee for the test. They've been with us from day one. We also have all of our hospitals that have the ability to test. Of course, as they say, call ahead of time, as well as Community Health Network. You always have to call ahead of time. Don't just show up. Call ahead of time. They'll pre-screen you. They'll get you in. Also, you can go to your doctor. Your doctor will hook you up with the private labs. Quest, LabCorp, you can do the testing there. Some of our emergency rooms also have the ability to test. We've also had the Texas military in. They were here April 24th in Pearland. They tested 74 people that day. Of the 74 people tested, they had 1 positive, 73 negatives. Last Wednesday, they were back in Pearland at Shadow Creek High School. They tested 143 people there. Saturday, they were in Lake Jackson. They tested 101 people there. From those 2 testing operations, we haven't gotten the results back to how many positives, how many negatives. Those were done by the Texas military with our support, with the support of Pearland, with the support of Lake Jackson to help facilitate those. Mobile drive-through clinics, they worked very well. Also, community network partners, for 2 weeks, they had free testing at the Angleton Fairgrounds. Last week, they were in Sweeney, tested all week there at Sweeney Community Hospital. This week, they started today. They're at Brazosport College from today through, I believe, the 15th. Again, free testing, mobile testing. You don't have to get out of your car. Call ahead of time. It's on our website, how you can call, get a patient ID number, and go through and be tested. So we're trying to get as much testing out there for people as we can. I know there have been over 5,000 tests administered in Brazoria County. We only know of ones that tell us. There's the private labs don't tell us how many they've tested. A lot of the emergency rooms don't tell us how many they've tested. So we just know that we've got over 5,000 and it's probably well beyond that. So that's kind of where we're at today with our number of cases, with our testing, and the testing will be ongoing. We're going to try to have the Texas military back in Brazoria County with the governor's orders yesterday to test every nursing facility and the meatpacking plants. That's going to take that resource and redirect it to those locations for a little while. But as soon as we have that ability to get them back, I'm going to get them back, and we'll continue having them come into the county to provide those testing opportunities.
One thing that I know a lot of folks have been following is things that they can do outdoors. And I wanted to bring up the beaches and just get an update in terms of the beaches being open and any guidance you would share for folks that are planning to go to the beach to hopefully relax.
I will say this. Well, I lifted the order on the beaches on, so May 1st, our beaches were open to vehicular traffic. Our beaches have always been open. We did not close our beaches. They were just closed to vehicular traffic. If it were just county citizens enjoying our beaches, we would be fine. But we also live in a metropolitan region with about 6 million people, and a lot of them like to come to Brazoria County beaches, and the beaches got overcrowded initially. That's why we closed them. They've been reopened. People need to continue to social distance. They need to continue to wash your hands, wash them frequently. They need to be smart. Just because the economy's back open to a degree, because the beaches are open, people still need to be smart about how they conduct themselves. And there's still going to be opportunities for the disease to be spread. I've encouraged citizens, please look at the requirements that the state has put out to businesses that are opening up. Get familiar with that and then patronize the businesses that are doing everything that those businesses can to protect their employees and to protect their patrons. Those are the businesses we need to patronize, is the ones that are doing everything they can to protect the general public.
And going back to resources, obviously you mentioned historically the testing that's been available, and then also the testing that's available today and for the rest of this week. What other resources are there out there for folks? I had read a little bit about the rent and utility assistance for folks that have been impacted by COVID-19. Can you speak to that a little more?
Yes, ma'am. There's some funds that have been made available, some federal funds, and they've been allocated to the United Way of Brazoria County, the Salvation Army, and to communities and schools of Brazoria County. That information is out on our social media and on our website. So folks, please go there. The information is this flyer right here. It's got the phone numbers for each one of those organizations, so folks can call to see if they qualify for that assistance. Because I know a lot of people are struggling as we have gone through this for the last couple of months.
Mm-hmm. And also in terms of resources, folks that may need to file for unemployment through the state. I know that's not a county function, but where would you direct them if they're having any difficulties with that process or needing some more guidance in that regard?
We've got information out on our website and on social media, but they can also contact their state reps and their state senators. Our state reps and state senators have been fantastic about assisting people, and they've stepped up with their staffs in assisting folks with that process. So I would encourage them, if they're having a problem getting that done, to reach out to their state reps office, their state senator's office, and they can point them into the right direction to assist with those benefits.
Wonderful. And lastly, I just wanted to commend you all with the county for highlighting the recovery rate. It's been really wonderful to see that you have more recoveries today than you do active cases. And y'all are one county that's done a great job of highlighting how many people have recovered each day, which I think is a very important message to instill confidence in the community, particularly as folks are trying to get back to patronizing businesses that you referred to earlier that are that are following, you know, the guidelines that have been put out. So thank y'all for highlighting that.
We're trying to do our best to share as much information as we can, and the recoveries are important. But we're continuing to try to emphasize to folks to continue to be cautious. You know, this disease is not going away. It's still there. And folks need to be very cognizant of their surroundings and what they're doing and how they're doing things. And we as human beings are social, and it is hard for people to break those habits. You know, men shaking hands. I mean, that's just one of those things right now. That's a hard habit. Our dads instilled in that in us from when we were little kids. And it's a hard habit to kind of shut down right now while we have this disease out in the community. And people, you know, like to get together. They like to hug. They like to talk. And just to kind of space out and break that lifetime of habits while we go through this, it's difficult, but it's something that we need to do to deter the spread of this, because, you know, about 15% of the people that get this disease end up in the hospital. It may be they go to the hospital, they are diagnosed, they spend a night or two, and then they get to come home, or they're diagnosed and 4 days later they have to go to the hospital for a day or two, or they're in the hospital for a long time. So it's, you know, we're trying to keep that down, because we just want to slow this down so that give the researchers out there a time to find a vaccine, improve the treatments and everything that they can do to shut this thing down at some point.
Exactly. We will wrap it up, but is there any other final comments or any other suggestions you'd like to provide, Judge Sebesta?
A huge thank you to my staff and county employees, like, you know, Sharon Trower, my PIO, Kathy Spruce, Dr. Scott Rogers, Jerry Yenny, the district attorney, just to name a few folks who have not had a day off in the last 2 months. They are working every day, trying to keep the flow of information. The epi nurses that are out there talking to our active cases each and every day. They make those phone calls, that contact tracing. They're working their tails off, and I can't thank them enough for doing what they're doing to try to get this thing slowed down.
It's so important to have wonderful and talented staff, and that certainly shows through your efforts and through the efforts of the county as a whole. So thank you all for your service during this time. And would you like to give the county website one more time, just in case folks didn't catch that?
It is www.brazoriacountystx.gov.
And thanks for joining us
Thank
for
you.
this community update. Thank you to the Alvin-Manville Area Chamber of Commerce for providing these types of opportunities to keep our citizens informed.